Let's focus on prostate anatomy from proximal to distal. These are terms that are used to describe the base of the prostate, which is going to be up higher, and the apex of the prostate, which is going to be down lower. We're going to divide from top to bottom the prostate into thirds. So we have an upper third, which is going to be the base. We're going to have a middle third, which is going to be the mid. And then we're going to have a distal third, which is going to be the apical portion of the gland. You'll also hear the gland divided up from medial to lateral. Now, we've already given you some designations for the zones and some abbreviations for such, but some people will actually divide the gland into a more mesial intermediate portion of the gland and a less mesial lateral portion of the gland. And it's actually described as intermediate mesial and lateral lateral. So you'll hear that designation floating around. I personally will just call it medial versus lateral, which is pretty simple, and I will use the abbreviations that you learned in the axial anatomic vignette. Okay, so let's take this all off the screen for a minute, and now let's look at the gland appearance as we go from base to apex. Now this might be a little bit confusing, but it's actually not as challenging as you might think. So let's start with our axial pancake of a prostate gland here in the upper third. So in the front of the gland, we've got the left and right AS, or anterior fibromuscular stroma. Then we've got the transitional zone behind that. Let's make the transitional zone a little more posterior. And we're going to have a TZA and a TZP on each side, so you can divide that in half. And you're going to have the urethra and the periurethral tissue. We'll make that gray, kind of smack dab in the middle there. And we'll even draw in the periurethral tissue just for giggles. Here's some periurethral tissue right here. And then behind that, we're going to have in blue the central zone. And it kind of looks a little bit lobular, and the central zone and TZ make up the central gland, and they will progressively enlarge as you get a little bit older. And then everything else around the outside is going to be the PZ. So we're going to have right PZA, PZP, PZM in the back, and left the same thing. So that's your base appearance. Now let's go to the mid-level of the gland, and I'm going to draw that again, but I'm going to keep my other diagram up intentionally so you can make a comparison. And now it's virtually identical, except that the anterior fibromuscular stroma tends to coalesce more as sort of one structure as you go down a little bit. They kind of bleed into each other. So you can't really distinguish so easily a separation between right and left. Now, the TZ, which we've got in orange, is going to kind of take over here at this level. We don't have a CZ because the CZ is only up in the upper part of the gland, the central zone, part of the central gland, and then everything else is peripheral zone. So we're going to have PZA, PZP, and PZM on the right and left. All right, now we've got to go to the apical portion of the gland. See if we can get our green color out again. The gland's getting smaller because you're going down. That's no secret or surprise. And now the transitional zone is also going to be a little bit smaller, but you're still going to have a smaller TZA and TZP, which are front and back bisected right in the middle. You're still going to have a urethra with periurethral tissue. I didn't bother to put it over here. I probably should have. Here's your urethra again. We've got some periurethral tissue around it, and you'll be able to separate those out by their signal intensity on MRI, and then everything else down low is going to be PZ. So there's no central zone down here, and the anterior fibromuscular stroma is once again going to bleed together in a kind of a short, stubby little flat structure here anteriorly. Then we go down one more cut. Down at this level, we're out of the prostate gland, and we're simply and purely in the urethra with the periurethral tissues around it. And then we run into the external sphincter in your urogenital diaphragm, and we have a sphincter up higher at the level of the bladder. So those are the three basic levels you're going to see: base, mid, and apex. And then you'll have a medial and a lateral, or an intermediate and a lateral component to the gland. So let's move on to the sagittal if you have time to watch with us, shall we?